Good evening, everyone, and welcome. My name is Dr. Kim Hecht. I am the Medical Director of Inpatient and Ambulatory Care Services at the Susan Samueli Integrative Health Institute. Thank you so much for joining us during our free community lecture, Integrative Insider Live. Our main clinic has moved to the UCI campus. This brand new space is designed to best empower you on your whole person health journey. We also offer integrative services at UCI health sites in Newport Beach near Fashion Island, Pacific Breast, and oncology, hematology at the Pacific Medical Plaza in Costa Mesa, Yorba Linda, and Laguna Hills. For tonight's session, and as the new year is among us, New Year's resolutions are top of mind. Do you know how to make lasting lifestyle changes? We are going to hear from our health and wellness experts to optimize your experience of well-being and help you make lasting lifestyle changes. Before we start, a few Zoom housekeeping items. We are recording the session, and after the session, we will post this webinar on our YouTube channel. In this webinar, everyone will remain on mute and the video off. Please utilize the Q&A feature at the bottom of your screen for any questions or to communicate with us during this session. After the presentation, I will moderate a Q&A session. On to the main event. Tonight, we have the pleasure of hearing from three panelists, Dr. Robert McCarran, Dr. Marcel Hayashida, and Teresa Nutt. Our first speaker is Dr. McCarran, the samueli.institute Director of Education. Dr. McCarran completed a dual residency in internal medicine and psychiatry at Rush University and received board certification in psychiatry, psychosomatic medicine, and internal medicine. While on faculty at the University of California, Davis and Irvine Schools of Medicine, he started the only two California-based combined internal medicine and psychiatry residency programs. In these roles, Dr. McCarran received grant support to create and implement a med-psych curriculum that can be used in the public mental health system by psychiatry residency training programs. He is the founding director for the UC Davis Train New Trainers Primary Care Psychiatry Fellowship, which is a one-year program designed to train primary care providers in the essentials of psychiatry and pediatric behavioral health. Please join me in welcoming Dr. Robert McCarran to Integrative Insider Live.
Thank you, Dr. Heck, for the introduction, and really happy to be with all of you this evening. It's really an honor to start the new year with you. And my goal tonight is to sort of set the stage for a discussion on best approaches for a particularly healthy and well new year. And to really talk about the Susan Samueli Integrative Health Institute educational initiatives, particularly the newer initiatives, as well as upcoming educational initiatives that I think will squarely address some of the health concerns that we have nationwide, and particularly, and I want to focus a little bit more on behavioral health issues like depression and anxiety. And the programs that I'm going to briefly detail, I think, uniquely address some of these issues that we're seeing. And in addition to that, our showcase program, the Susan Samueli Integrative Health Institute Health and Wellness Coaching Program, is off to a great start. We start our second class actually next Tuesday. And so excited to give just a little bit of information on that and then hand it over to my colleagues for some more really practical day-to-day information on health and wellness coaching. So I want to talk a little bit about sort of the problem that we're seeing nationally when it comes to particularly behavioral health issues, and how the Susan Samueli Integrative Health Institute is leading the way to squarely address some of these concerns, and particularly when it comes to education. And we'll talk about three programs in particular. But first, the current state of behavioral health care in this country. And if we go back to a study from the CDC and information from the CDC in the summer of 2021, we see that just under half of adults were struggling with mental illness. This number is roughly the same now in 2023. And we see that about a third of adults are affected with either anxiety or depression being the number one cause of disability in adults worldwide. When we look at the percent of folks who have started or increased substance misuse, we see that's about 13% and just over 10% during this particular time frame in the summer during the pandemic. For those seriously considering suicide was just a little bit over 10%. If we look at kids, it's a little concerning, I would say, and this is information from UCLA Center for Health Policy Research, and this was a brief published in January of 2021, looking at the fact that nearly 1 in 3 adolescents in the state of California report serious psychological issues. 1 in 3. About half of kids between the ages of 10 and 17 years have some type of behavioral disorder or psychiatric disorder, about half of them. And unfortunately, among adolescents, we see that suicide is the leading or the second leading cause of death. And when we saw during the pandemic, during the height of the pandemic, that female adolescents suspected of a suicide attempt in an emergency room setting increased by about 50%. When compared to pre-pandemic numbers. So very concerning, certainly, that we're seeing this with kids. We look at use of drugs. We see that over 100,000 Americans died of a drug overdose during the time period of April 2020 to April 2021. That's about 275 per day, and that's a 30% increase when looking at data from 2018 and 2019. A lot of this was due to fentanyl, not all of it, but even extremely small doses of fentanyl can kill within minutes. And we're seeing certainly that being a national problem. And I say national because it is worldwide, but if you look at these figures here and looking at overdose deaths by country, and this is looking at 2019, and this is really looking at deaths per 100,000 people. And a lot of these statistics here are from Europe and Eastern Europe and areas geographically in that region. And we see that in Norway, for example, or Sweden, it's about 5 people per 100,000 deaths per overdose. In Italy, it's 0.6 people per 100,000, and we're looking at deaths from overdose. In the United States during this time period, we saw a significant, I think, disparity, a difference here, over 20 people per 100,000 in the population dying from overdose. So certainly this is a regional and a national issue that we are dealing with. And I think so far, not very successfully. Looking a little bit further at the people here in this country that need some type of behavioral health care or psychiatric care, we see out of all the folks that need this, keeping in mind, as I mentioned earlier, depression itself, just depression is the number one cause of disability worldwide. We see that about 60% of those needing behavioral health treatment or psychiatric treatment aren't getting it. Just not getting it. They're struggling. They're suffering. And about 40% are getting care. And of that 40%, the majority of that 40% getting care are receiving it from primary care providers, those who receive very, very limited formal training in the area of behavioral health care delivery. So that also is a problem. Looking just at the system of care from an educational standpoint, there are some gaps here, certainly. If we look at physician burnout, we see that particularly during the pandemic, just under half of physicians nationwide are struggling with burnout. And we see here on this particular slide that this is further classified into the type of physician, And this study coming from January of 2022 showing that about 60% of emergency medicine docs, about 55% of critical care docs, 53% of OB/GYN docs, 50% of family medicine doctors struggling with burnout. So it's something that we need to be aware of, right? Particularly if the people who are working to make us feel better, to try and help us heal ourselves, are struggling, then we know that that certainly is a problem. So here's what we've been trying to do at the Susan Samueli Integrative Health Institute, really looking at the fact that innovative education solutions can indeed bring healing, can bring peace, can bring wellness. And I'm going to give a couple quick examples here. First, looking at our academic integrative medicine fellowship, right? And so this is a program that they're working on and hopefully to be developed, finalized late this calendar year. Really excited about this. This is a 2-year program with 1,000 hours of instruction, really geared towards primary care-based providers, doctors, and really trying to help them better understand how to include wellness and whole person care and integrative health and medicine into their daily practice. And this is I think important, right? In terms of trying to decrease the risks and the angst associated with behavioral health conditions. We also are designing this particular program to really help train our learners who provide care within populations with underserved patients. We look at this particular fellowship as a way to become a leader in primary care-based integrative medicine. We also are going to teach our learners how to teach these basic concepts in integrative and whole person care. And really also thinking it important to bridge academia with community. And then lastly, making sure that what we're teaching is looked at very carefully, and we're making sure that the outcomes are measured so we can look at whether or not our teaching is affecting change in the community. Very important. I'm going to take a few minutes and talk about our integrative transformation of education, administration, and children's health, or ITEACH. And again, this is designed to address some of the statistics, the concerning statistics that I brought up just a few minutes ago. And again, this is an early phase of development where we've been exploring collaboration between UCI and Orange County Department of Education and other areas, and really looking to optimize mental health care, right, for students in between kindergarten and high school and 12th grade. And there are 3 main ways we want to do this. The first is to teach teachers about the basics, the essentials, if you will, of whole person integrated care. Right? How can teachers maintain a better sense of self, a healthier sense of self? And so that's one component of this year-long curriculum. The other component is, how can teachers recognize early stages of depression, anxiety, substance use, or even violence at home? And so teaching teachers how to recognize this in the classroom is going to be really important for us to get early intervention for some of our most vulnerable citizens. And then lastly, we also want to make sure that our teachers are able to detect in a very early way any type of escalation or pre-escalation in the attempt to decrease any type of violence in the school setting, something that's increasingly more important as we've seen more gun violence and other types of violence in the school setting. So this is sort of an overview of ITEACH. We're looking forward to building this out over the next few years. I want to take a couple minutes and talk about our academic integrative medicine health and wellness coaching certificate program. This is a program we launched last year, and I'm glad that 2 of my colleagues are here to talk a little bit more about it and how it can really relate on a more individual and personal basis. But from a higher level and looking at what health and wellness coaching is, it's really helping other people, helping clients and patients to reach a point where they're self-directed and looking for lasting, meaningful, sustainable changes, where the health and wellness coach has an unconditional positive regard for their clients in the belief, their capacity for change, and honoring the fact that each client is an expert on their own life, right? And so they're really guiding folks to feel better, and to be better and to be more at peace, really. The other thing too is the health and wellness coaches and our graduates from this program go on to become important team members for general health, behavioral health, and specialized healthcare delivery. Now, I have on this slide that there are nearly 6,500 board certified health and wellness coaches here. I can tell you that after talking with leadership from the National Board of Health and Wellness Coaches just this afternoon, we know that there are more than 8,000 now, more than 8,000 board certified health and wellness coaches through the National Board of Health and Wellness Coaching. Now, currently, there are 3 Category 3 CPT codes that were approved in 2019, and the goal is to try and get those fully approved this summer. And so definitely the board is working on this, which would basically mean that graduates of the UCI program and other similar type programs, when board certified, can really get out there and help folks and also bill for that time. So there's a rapid expansion of health and wellness coaching, and we're excited to be a big part of that on the forefront of health and wellness coaching. Our program philosophy is really driven on holistic and integrative health, whole person care, and making sure that we're working and our graduates are working in a very collaborative and interprofessional manner. As mentioned earlier, we also have a strong focus on working with underserved and those who are unserved, working to expand and extend care in those particular settings. So we believe in team-based care is probably the best care when it comes to medical care and behavioral health care delivery. Again, leadership and among coaches, and looking at whole person care and really supporting those who are living in underserved areas. Again, we've been approved as of about 1.5 years through the National Board of Health and Wellness Coaching, and our graduates, once they meet all the requirements and pass the exam, after finishing our course, also are board eligible to be certified by the National Board of Health and Wellness Coaching. There's a quick overview on our first cohort of learners. About half of them have a doctorate or a candidate for a doctorate degree. 3 of the 15 had a RN or doctor's or nurse practitioner degree. 10 of the 15 had a master's degree or higher. Many of them were UCI employees, one of which you'll hear from here in just a second. All of them had a bachelor degree and had a strong interest in integrative whole person care. And so we also have recently started a behavioral health track to this program. So really excited to see this move forward, excited to see innovative education solutions and bringing these solutions towards expansion and optimization of healing. Glad to be with all of you tonight, and look forward to any future questions. Thanks so much.
Thank you so much, Dr. McCarron. That was a very great introduction to our next speaker. And, you know, Dr. McCarron did a great job of framing what the issues and challenges are that we face today with depression and burnout among healthcare providers. So with that said, I'd like to introduce a special guest, Dr. Marcel Hayashida. In her role as Associate Vice Chancellor for UCI Wellness, Health, and Counseling Services, Dr. Marcel Hayashida oversees campus recreation, the Office of the Campus Social Worker, Care, Child Care Services, the Counseling Center, the Disability Services Center, the Student Health Center, and the Center for Student Wellness and Health Promotion. So she oversees quite a bit at UCI. Dr. Hayashida is a licensed clinical psychologist in California, and she has worked in a variety of settings, including private practice, college counseling centers, and as Assistant Professor of Psychology and Black Studies at Pomona College. She received her PhD in Clinical Psychology from the University of Michigan and graduated Phi Beta Kappa from Vassar College. Dr. Hayashida has authored articles on African American mental health and college mental health, and has presented nationally and internationally on topics including trauma-informed care on campuses, mindfulness in higher education, and Black women's leadership in higher education. We have the pleasure of hearing from Dr. Hayashida as she is an inaugural alum of the Health and Wellness Coaching Program.
Thank you so much. And I really appreciate the invitation and the ability to be here. Happy New Year to you all and good evening. So as you heard, there are 8 units that report to me, and I also do threat assessment for the university. I'm a psychologist, I'm a yoga instructor, and so perhaps you can tell that I've always been interested personally and professionally in well-being and in supporting people in meeting their health goals. So the coaching program that I took, and I saw an advertisement, last year and thought that's going to be perfect for me. It's a natural outgrowth of a lifelong personal and professional interest in well-being. And that lifelong interest probably started when I was young. I had asthma and allergies as a little girl, and later in life diagnosed with some autoimmune issues. I have ulcerative colitis. So I really spent my adolescence and adult life dedicated to finding evidence-based ways to manage my own conditions and to help other people manage theirs. So for me, when this health coach training program presented itself, and when it advertised itself as being a program that would train people to serve underserved communities, when it had an emphasis on ways of healing from multiple cultural perspectives, I knew this was going to be for me. I could tell this was not going to be a program about pseudo-scientific approaches from wellness experts without degrees or credentials. This was going to be a rigorous, evidence-based curriculum dedicated to really helping people enrich their lives. And it was. I loved it. Perhaps you can tell I like school very much. And so I would look forward to the weekly live lectures, and then I would listen to the asynchronous lectures while I was walking around the soccer field while my kid had practice on Thursdays. And the program naturally drew on my counseling background, but coaching is very different from counseling. And the instructors were really lovely with me as I learned and explored the differences in the basic assumptions about clients. I really enjoyed learning from the other professionals, nurses, researchers. There was a veterinarian as part of my cohort, and somehow virtually made really lovely connections with folks as we talked about our own health challenges and coached each other. The coaching triads were actually my favorite part because I could give feedback on what I witnessed. I could practice coaching, and then I could get the benefit of being coached myself on real health issues that were happening for me in real time. I also really love the mindfulness component. It's really a key component to coaching. And one of the early short answer assignments that I completed was after a module on mindfulness. We were asked to pick a mindfulness practice and write about it. So I decided to pick mindful driving. I'd never heard about it, never done it before. So I was going to drive more mindfully. So I was driving my kid back from soccer practice. It's late, I'm tired, we're both hungry. But I turned off the radio and just really tried to focus on observing new things around me within the road in silence. And normally I'd have the radio, we'd be singing along. So I paused to get off the freeway as a light turned green. I just paused for an extra few moments. I paused just a bit longer than I might normally have. And somebody flew through a red light. And so I am convinced that had I not been driving mindfully at that place, on that night, at that time, that we may have been hit by a car. So just a testimony right there to finding new ways of being mindful and putting them into action immediately helped me. So how will this affect me in the future? So now I own a business. As an alum of the program, I opened up a small coaching business practice on the side. And I'm really hopeful that also in the future, we can think about adding health coaching as one of the student services that we offer. It wouldn't be me. I'd hire a board certified health and wellness coach. And now I know exactly what to look for. I also think and hope this is affecting my effectiveness as a leader. I've been reminded of the importance of mindfulness in my role as a leader. I've also been using some of the skills as I work with my directors. I ask them more open-ended questions than I think I did before. I elicit, provide information, and then elicit some more. I assess how ready they are to make some changes and kind of dose my comments based on how ready they are to change. So I think the program is actually already made me a better supervisor. All in all, it's a transformational experience for me. And in learning how to be a coach, I was really able to learn a lot of behavior change tools that helped me personally. So thank you all for listening. I wish you the best of luck in supporting your lifestyle changes.
Thank you so much for sharing your experiences with the health and coaching program, as well as that really life-saving experience of how to use mindfulness. Definitely, it sheds like a different light on how mindfulness can benefit you, because normally we kind of think of it as de-stressing as opposed to like really being a part of your environment and also like being able to respond at a moment's notice because you are mindful and aware. So thank you so much for sharing that. Now we have the pleasure from hearing from Teresa Newt. Teresa joined the Samueli.institute team last fall as the Director of Health and Wellness Coaching. Teresa was the co-director and teaching faculty at University of Minnesota's Integrative Health and Wellbeing Coaching Program, where she taught a number of courses for 7 years. She received a bachelor's in nursing from Viterbo University in La Crosse, Wisconsin, and a master's in human development from St. Mary's University in Minnesota. She has a 2-year degree in personal coaching from Coach U, now called Coach University, and she has also served on several boards dedicated to coaching over the past 7 years. Teresa has been a nurse since 1995 in a variety of settings, including inpatient, cardiology, oncology, medical units, hospice, public health, and school nursing. Please welcome Teresa.
Thank you so much, Dr. Hecht. And while I get my slides up, welcome everyone to this new year. Looking forward to sharing with you. And I'm going to start with the funny 2 cents that you'll find out real soon, that I don't really love New Year's resolutions. So I want to start with the story. We're going to talk about how to make lifestyle changes last. The thing is, I got this email today and I'm like, this is just perfect. So I'm going to read it. I don't know about you, dear reader, she says in her newsletter, but some of this New Year marketing just turns my stomach. Yes, I know it's a new year, and I know that means we're in the flow of the marketing tide. But why in the name of all things do we still need to be fed the new year, new you thing yet again? I don't want a new me. I kind of like the one I already have. I liked her on December 31st of 2022, and I still liked her when the clock struck midnight and that ball dropped. And I don't want to really replace her with a new version just because it's a new year, just because some guys are selling fitness memberships, keto diet pills, new Jeeps, fancy socks, and anything else you can think of. I think I'll keep her in all of her quirky glory. I'll keep being this me that I have grown and tweaked and prodded and shifted and sculpted and morphed. Because in the end, she is pretty fabulous. But in the end, does that mean that I won't tweak, prod, shift, sculpt, or morph any longer? Is this the end of the road or something? No, it's not. It just means that I'm happy with the me that I am, and that marketing tactics probably just won't apply the same way this year. And I know that if I start out happy with where I am, then the growing and the tweaking and the morphing happens without so much effort on my part. Not because of some other external pressure, but just because. So with that, I want to lead into our presentation about how to make lifestyle changes that last, and also talk about the wonderful health coaching, both the education side, which you received the background of, but also the clinic side that we have at the Samueli.institute. So one of the reasons I started with why I don't like New Year's resolutions, which many coaches do, is they're often made for all the wrong reasons. And as a result, they tend to not put people in a very good place of following through. So they're made out of guilt. They create this unnecessary pressure that people put on themselves. They're made in haste, right? Like, oh, it's a new year. I've got to quick change something. Some people force several changes all at once, like I'm going to change everything, and then they start nothing, or make it a week and then stop everything. They create this need to do it differently, right? Like starting from this place of deficit, like I'm not already okay. I've got to do it all differently. Some people just aren't specific. It's like, oh, I have this idea, I need to change. Well, what does that mean to you? Or they do it for someone else. So those are my reasons for why New Year's resolutions are not my favorite thing to talk about. But I will gladly tell you that change is very possible, but maintaining it takes patience and practice. And that's what we want to talk about tonight. So why is change so hard? This sounds like a depressing thing. It's really not. But the truth is our brain is wired for something called neural efficiency. I love that language. Basically, when you boil it down, our brain says, I want to do the thing I know how to do the fastest way. So whatever you've been doing for a long time is the most efficient. Therefore, it's going to want to take you back to that old habit. That's why choosing a new change and following through with it is not as easy as it sounds. We also have the stress response. Each of us deals with stress in different ways, which is why working on mindfulness and other stress management is so helpful, because when we are in a state of constant stress, we tend not to be able to follow through on our goals. Also, plain and simple, we're creatures of habit, so old habits die hard. That is true. Research proves that. Another big part of it, sort of under the surface, is that others don't often want you to change. So people who have certain behaviors often do it in community, right? I think of my father was a longtime smoker, and there were extra breaks and there were other things. So there was a community around his bad habits, so to speak. So it can be hard for you to change, because then suddenly you're not part of those community belonging experiences, which are a very basic need of any human. There's also cognitive distortions, which we won't get into, but it basically means our mind tells us things like, I have one bad day where I don't follow through. I'm just going to quit everything. We call that all or nothing thinking. And there are many more. So our mind can sort of trick us into stepping off. We call it sabotage in coaching, sort of stepping off the train and not following through with our new habit. And there's also a fear of the unknown. We often engage in behaviors because they're familiar and there's a comfort level with them. So we have to step into the unknown when we're moving forward with a healthy behavior change. So in my experience of 20 years of coaching, this year will become my 21st year in March. I have recognized that there are really 7 ways that help you make lifestyle changes last. So I'm going to list them here, and then we're going to do a deep dive into each one. You've got to start with a bigger why. Item number 1. It's really going to drive everything else around the hard practice of making behavior change. I invite you to create intentions, not only goals, and we'll talk about that one in more detail, because people often get really narrow focused and then they don't allow themselves to experiment long enough to figure out what's really going to work for them. Taking small action steps consistently, not just what you physically do, but what you mentally do, will make such a difference in following through. Building in support and accountability. Most of us on our own, back to neural efficiency, will not follow through if we don't have systems of support and accountability built in. Redesigning our environment. It's one of my favorite topics with coaching clients, because we often don't make space for the change, or we don't design our environment to support the change. So we find ourselves doing the same old things. And there's so many easy things you can do to redesign your environment. Also, expect and plan for setbacks. Back to this is not meant to be depressing, but it's true. Change is hard. And so we want to put in place for ourselves, like self-compassion, for when we fall off the wagon or things get tough, that we treat ourselves well, because we will be more likely to get back on and start working on the habit again. And the other is to celebrate along the way. Certain changes take a fair amount of time, and so we have to build in little milestones that allow us to enjoy the process and celebrate. Positive psychology says that works really well. So we're going to break it down here. These are the ways to make it last in detail. And I want to start with what we call in coaching a vision, really the bigger why. Asking ourselves, what do you want your health for? A year from now, what would be different? It's that visioning process of really thinking about how would we be moving through our world? What would our life look like? What would be possible? What matters to us? What inspires us? All of it. So really, this opportunity to find the bigger why within ourselves is so important. And you can start with, just to give you a quick coaching side note, is like sometimes people try to, one of the things I see with New Year's resolutions and otherwise is start with the big thing, right? Like I need to lose 100 pounds. Well, maybe that's so overwhelming for you that can be part of your vision, but you start with what we call a lower hanging fruit, something easy that lets you feel like you're making momentum and building confidence in yourself and your ability to follow through. So part of our work as coaches sometimes is to help people create the bigger vision and then find the right place to start. So start with that bigger why. That's really going to drive you, especially when times get tough as you're making the change and sticking with it. So here's my intention versus goal lecture. This is so important to me because, as I mentioned before, I think sometimes people start way too specific or narrow. For instance, exercise is so easy. And of course, I don't know if you know, but the statistics around gym memberships in January always makes me laugh. I've been teaching on this topic for at least 15 years, and it's always been true. People go steady and strong in the month of January, and then by February 3rd, no one's going to the gym anymore. Part of that is that they're too specific. So the only way I can get exercise is by going to the gym. Well, maybe not. So give yourself wiggle room until you figure out what's truly going to work for you and create different ways to succeed. So an intention might be, I want to get more movement in my days. Whereas a goal might look like I'm going to go to the gym 3 days a week. And even within that, part of going to the gym might be first just going to the gym and going to the parking lot and parking your car and saying, okay, I made it to the gym, and then driving yourself home. And then the next time you go in and you swipe your card so you know how to get in. It's like sometimes people need it broken down so they can learn how to go to the gym without freaking out. So we just create wiggle room, right? Like how can I make it so easy to be successful? A lot of people think that like going to the gym, or maybe I'm just going to lift weights or whatever it is the only way. But maybe you find out walking your dog and dancing or something else is actually what you're going to follow through on. Well, that's more important than having a specific way of doing it. So really building in experimentation, having a focus, build in experimentation so that you have a solid plan that's truly going to work for you when you're done. And then the start small and be consistent part. So when I think about this with coaching clients and anyone in general, it's like you need to prepare for success. What would success look like? So for instance, I can think of many years ago when I started running more consistently, it was like for me, I'm best first thing in the morning. And so I would lay out my workout clothes at the bottom of my bed, shoes on the floor, clothes at the end of the bed, so that when I got up, I was ready to go. Also, telling myself who I'm becoming. I'm a person who gets more physical activity. I am a person who. You start telling yourself mentally who you are becoming. So let's go back to the example of the gym. Maybe you don't go to the gym 3 days a week, or maybe you only go 3 days a week. But on the other 4 days, can you say to yourself while brushing your teeth in your head, I am a person who goes to the gym 3 days a week. It's just a way we start to build in our mind that new way of who we are becoming. Again, make it easy to take the action, prepare for success, keep going even if you fall off. That's the part where a lot of people tend to stop. It's like every time you fall off the wagon, it's a learning opportunity. What about that didn't work? What do I need to plan differently for? And since the holidays just happened, and I can think of, I'm from a giant family. I have 7 siblings. And when we gather for the holidays, there's about 35 people marching around. Where I fall off the wagon is eating my mom's food. I mean, she was a caterer. She's a great cook. It's stuff that I can't digest, but it's got all kinds of mom's love in it. So when I fall off the wagon, I just got to come back and start again, right? So that's part of it. and also being willing to give ourselves time to learn, just taking action until we learn. Building in support and accountability. So one of the things I know for a fact, having been a coach this long and helped so many people over the years, is often what doesn't work here is thinking that the people in your life who you are closest to are going to be your best support and accountability. That may or may not be true. Sometimes the people we love the most have the hardest time seeing us be successful in a change that leaves them feeling left behind. So you want to think about who you identify, who's going to stand by you when you make these changes. What's going to keep you engaged? I'm going to just use Dr. McCarran as an example, only because we work closely. It's pretty clear to me that he's very extroverted, or being around a lot of people is very engaging for him. Whereas for me, I'm more introverted. So I would tell one or two close friends, but probably not a big group of people. So whatever it is for you, figure out what's going to keep you engaged with your goal. How much support? What does it look like? Also making your success along the way visible, because we often wait for that big thing that might be 6 or 9 months down the road, and then we just lose momentum. Versus some people might track on the refrigerator, like, okay, 3 times this week I did my goal, whatever it is, keep it top of mind. It reinforces for you that you are making progress. Other people need reminders. So, maybe on your phone, maybe on your refrigerator, maybe a Post-it note in your bathroom, whatever it is, but right, you want to keep on keeping on, and creating reminders can be a great way to do that. And then again, rewarding yourself at milestones. One of my favorite stories, real quick, was I had someone who was working on her physical activity, and she was a swimmer, or that was one of the things she was reintroducing. She had been a swimmer and she was coming back to it. So when she met her goal for 3 months, she bought herself a new swimsuit so that swimming would be even more enjoyable. So rewarding can look like a lot of different things, but it's a great way to, again, reinforce the behavior you want to continue engaging in. So again, I told you this is one of my favorite topics, redesigning your environment. Because one of the things we need to do when we're going to make a change is not make it so easy to do what we've always done. And that is not an easy thing to do in the end. So you want to remove whatever doesn't support you. For instance, when people go on weight loss plans, often they're asked to go and clean out their cupboards, right, of all the temptations that might make it too easy to just grab for something, to maybe put foods they don't want at their fingertips up higher. So identify what you need and add it. Like, are there things you want to put in your environment that aren't there yet that will make it easier for you to follow through? And then another thing I always talk to people about is not only what you remove, but also when are you most likely to follow through? Part of your environment is figuring out, okay, do I have more energy for this first thing in the morning? Do I need to do it later in the afternoon? Am I a night owl? Like, what time of day is your energy most ready to help you take some new action? Create reminders and visibility. That's part of your environment. Like, again, maybe you need it in 3 or 4 places to remind you as you get started. And one of the number one ways to establish a new habit is to pair it with one you're already doing and doing consistently. So it bridges in our brain from a neuroscience perspective, that combination of what we're already doing that's working with something new that then doesn't feel as unfamiliar to us. So think about that when you're thinking about redesigning your environment. So planning for setbacks. I just want to say out loud, everyone, no matter how dedicated they are, no matter how disciplined they are, is going to have setbacks for any number of reasons. And I can give you one that was unexpected for me. Many years ago, I was in a really great fitness place doing yoga and Pilates and running every day and etc. And then I had this inner ear thing that no one could diagnose or find. I fell down the stairs, dislocated my collarbone. And for 3 months, I was immobilized. And so all of the things I'd been doing, it was the middle of winter in Minnesota, so I couldn't really walk or run. I couldn't do yoga or Pilates. So all of a sudden, I was way back to step 1 for myself when I had been in a really active place. So there are going to be setbacks, there are going to be hiccups. Help yourself remember that that's just a normal part of the process. Doesn't mean anything's wrong. And we want to have a plan for that. What's the plan for when things go off course for a number of reasons? One of the biggest things I always talk to my clients and patients about is the self-compassion piece. We can be so hard on ourselves. I've met so many people with really gifted inner critics. I say that tongue in cheek, right? People who are so hard on themselves when they have a setback, big or small. And instead, if we can meet ourselves with grace and self-compassion and just say, everyone struggles, change is hard. I'm so proud of you for getting up on your feet and trying again tomorrow, right? Like it's when we talk to ourselves that way, it reinforces our willingness to move forward versus making ourselves feel so badly that we often engage in the old familiar habit to comfort ourselves. So there's just a little quick tip about the importance of self-compassion. Have support. In recovery programs, people have sponsors. I think with, any lifestyle change, the same is true. We need support of all different kinds for when it's hard for us, when we feel ourselves slipping. Who's going to help us get back on track? Who are those friends or family members who can stand by your side? And, if you need a kick in the bum, they're going to give it to you. If you just need a hug, they're going to give it to you, whatever you need. And then also mind your mindset. Our mind is so darn sneaky. And when we get in a place of something not going well, it often creates a spiral of thoughts that are, as one of my clients used to call them, stinky thinking. Yes, indeed. Because we start to, as I said, use our inner critic and do other things to make ourselves feel like, well, I'm just not worth it. It's too hard. I can't do this. And all of a sudden, it's very hard to keep going. So you want to have some ways to turn that mindset around and prepare for it before it happens. And I mentioned celebrating wins along the way. One of the things positive psychology tells us is that when we note what we are doing right, it reinforces new behavior. And so we always want to note what we are doing right. We want to celebrate those small wins and milestones along the way. Often in our culture, we're focused on productivity and moving forward, for the most part in our Western culture. And what that doesn't do is allow us to slow down, smell the roses, and say, actually, I have been pretty consistent. I want to celebrate that. So it's something we can do to help make momentum easier to find. And don't wait until you've reached your big goal. One of the things I've seen clients do, and one of the things research shows, is if we wait too long, if we delay that sort of satisfaction of feeling like we're making progress, we often don't follow through to completion our bigger goals. So we want to have some little things in between. So I promised we're going to just transition to the clinical side of health coaching that we have here at SSIHI, the Susan Samueli Institute. And in particular, coaching is really about being a partner in creating lifestyle changes that last. So you sort of got my 2 cents worth about how to do that. I want to talk about how we do the work that's available in the clinic. One of the things that everyone in the Samueli Institute does so well is take a look at the whole person. From coaching perspective, we really want to support optimal well-being, and that's not just in one category of your health. So we're looking at you from every perspective, and we know that any positive change anywhere will move you forward in other parts of your life. So if we make a change, again, like I said, low-hanging fruit, sometimes there's something you can do that's small and easy that starts to build your confidence, and we just keep going until you're where you want to be with your health and wellness. Coaching is not. I thought I would share this slide because this is why I feel like coaching is so invaluable in an interprofessional team versus working on its own. Is we don't diagnose in coaching, and we don't do treatment plans, and we don't prescribe. And we don't really educate. We educate a little, but it's very different than the kind of education a person would get from health education. So all of these pieces and parts, our clients are getting somewhere else in their healthcare delivery model. This is what coaching does. It fills a gap in this interprofessional teamwork by we help people make changes, create their plan, identify their roadblocks, get the right resources, build a solid foundation of what we call self-efficacy, which just means I know I can follow through on what really matters to me. We help them manage their setbacks and get in touch with the right members of their healthcare team to get the support they need. We also are great at helping break down treatment plans so that a person can move it from often, especially people with challenging complex healthcare issues, need to really drastically change their lifestyle, and that can't always be done overnight. So we can help break it down, deal with the mindset things that are going to make a person fall off course, and figure out resources and assets and support systems and designs of the environment to all build in the feeling of success with major treatment plan changes. We also help build skills, not again from a high education standpoint, but things like using mindfulness and helping people become aware that stress is driving them, and then helping them figure out how they want to move forward with it. How to have relationship conversations, because often people's behaviors involve a relationship. So how do you advocate for what you want to experience with others? Self-care habits, healthy lifestyle choices, advocating for what you really want with others, prioritizing your health, time management, etc. And again, not doing so much education, but enough to get the concept across, and then really helping the person figure out how they're going to implement that into their life. And we started with the bigger why, and ultimately uncovering the bigger vision for health and well-being is one of the things that coaching is really great at. And holding that big holistic view helps people follow through. So I want to explain how you can work with a health coach that wants to support you in creating lasting lifestyle changes. So both Sarah Meyer and I work in the clinic, and you can see our many different specialties. I feel like at this point in my career, I've coached on just about everything and then more, but we're super happy to help you have a conversation, get started. Coaching works best when people come back because you really want to start to experiment with what's going to work best for you, get feedback and support as you keep going. So just wanting to point that out, you can learn more on the Samueli Health Institute page. There is information about health coaching in detail there. And if you want to know how to work with a coach, you can ask your provider for a referral at your next appointment, or you can call the Susan Samueli Integrative Health Institute main line, and they will help you schedule an appointment. So those are the two ways you can be in touch with a health coach. I want to real quick make the transition from clinical care back to education. And this is a part of our team. You met Dr. McCarran earlier, who has just been foundational in getting this program launched, and a bit of my partner in crime as I helped build the program last year and came on board as the director at the end of this past year. So I'm the director of the Health and Wellness Coaching program. And then Sarah Meyer, who is in the clinic, is also one of the health coaches teaching with us. And Lori Skorheim is our program coordinator, who we could not live without, who handles so many details behind the scenes. And then the last part, real quick, is that we have several lecturers from within the education system teaching on integrative health and many other parts of the program. Robert, what did I miss? Anything?
No, I think you got it all. That was perfect, Teresa. Yeah, thank you so much.
Thank you so much, Teresa, and all of our speakers tonight for your wonderful presentations. I'd like to remind the audience to use the Q&A feature. I do have a few questions right now that we can go off of. Let's start with Teresa. What is the typical health coaching commitment? If I were to make an appointment for intake, how many sessions might typically follow?
Great question. You know, I would say to you that most people do 1 or 2, but if you really want to make lasting change, you should do 4 or 5. That's my 2 cents.
And then, is there a way to find out like the best time of day for exercise, focus, productivity?
Depends on the person. I love that question. Every person's going to be different. So that's a little bit about when someone has energy and when someone's, you know, got more go. So we do ask questions about that.
Great. These next 2 questions are probably for Dr. McCarran. but I will have my own 2 cents as well. But Dr. McCarran, what other modalities do you typically recommend for depression aside from medication, or maybe the typical SSRIs or tricyclics?
Yeah, that's a great question. I'm a big believer that medication is not always the answer in medicine in general, right? And so, a couple thoughts. One, psychotherapy, or what we call talk therapy, can be really, really helpful, particularly cognitive behavioral therapy, where we look at our thoughts and our feelings and look at the connection. Very effective for also chronic pain. Mindfulness. So we learned a little bit about mindfulness. Marcel gave us a great example of how mindfulness can really do some powerful things, right? And the combination of mindfulness and also psychotherapy, and in some cases even an antidepressant, can be very, very effective.
Thank you. I would tell people that if you come to the Institute and see one of our providers, you will have a whole person assessment. And we will look at things like your digestive health. You know, they have found that there are different strains of bacteria that are seen in people who are depressed versus people who are not depressed. And even though we live in a first world country, there might be some micronutrient deficiencies. And again, some of that might be related to your digestive health. For women, particularly my postmenopausal and premenopausal ladies out there, hormones have a really, really huge effect. Yes, testosterone can also affect a man's mood as well. But I see it more often in my female patients. And just, again, looking at different lifestyle things, like if you're going to be eating pro-inflammatory foods, eating fast food, you know, just like a quick meal, those things, you may not know it, but can be affecting your mood. And then making those changes can be hard, so we will send you to Teresa and Sarah to kind of do that. And then also, like Dr. McCarran has taught cognitive behavioral therapy to patients in the past. So, you know, I would say there's a lot of different things that we can discuss. I do have a question for Dr. Hayashida. Like, you know, you are managing a lot of different things now, and in your training from, you know, as a health and wellness coach, a lot of it, I'm sure you might be doing some self-coaching now. What are the tools that you find that you're using the most in your own self-care?
Yeah, thanks. So one of the things that I'm not even going to call it a guilty pleasure because it's just a pleasure. I do enjoy reality television. So 90 Day Fiance, You're Married at First Sight, Your Housewives. So I decided that I was going to pair watching garbage television with time on my exercise bike. And I will tell you, I mean, I crave getting on my exercise bike. It was a pandemic purchase, and you know, it's not every time, but most of the times, that's permission. I will give myself permission to watch garbage as long as I'm on the bike. And I end up being on the bike longer than I would have because these are hour-long shows, right? So those are some of the ways that I'm trying to kind of use the coaching philosophies to I hate the word hack, but kind of hack my own life, right? So that's just
that's a really good tip. A lot of us binge watch a lot of shows these days, so it could be anything that you want to watch. So thank you so much. That could be another tip to creating one of your, you know, your healthy vision of yourself, and it can still include the things that in the past were a guilty pleasure, but now are part of creating health for you. One of the questions was, is health coaching covered by insurance? And my answer is it is not currently covered by health insurance. I did write down in the chat how much it is currently at the Institute. And then there was like, what is the best way to apply to the summer cohort? So Camber had put into the link, she put into the chat the link, but is there anything else, Dr. McCarran or Teresa, about applying?
Yeah, I can just jump in and then fill in anything I missed, Dr. McCarran. Yeah, there's, take a look at the website where Camber sent you. There's information there. I think we will be we'll have some information sessions in the coming year and months soon. So if you want to get a little more detail, there's information on the website already, but we'll have more coming. And thanks for putting that.
And this is the last question, and then we'll have to go. Teresa, if a client came to you, would you be able to recommend them certain sports or activities they may like based on their interest and evaluation?
Well, that is a loaded question. I love it. Of course, I can always offer possibilities, but I would want the client to choose what's going to work best for them. So yeah, great question.
Great. Well, thank you, everyone. And let me get back to my email. I'm like, here we go. So thank you for joining us for our Integrative Insider Live Community Lecture. Upon ending the webinar, a pop-up window will have a valuable survey on this evening's event. Please help us improve our community offerings by letting us know what you think. We will also be emailing key takeaways to the email address provided at registration. Our next Integrative Insider Live is scheduled in March. More information will be sent through our Integrative Insider monthly emails and posted on our events page on our website. Thank you again, and we'll see you next time.